To the whip, Katherine Clark.
Thank you, Mr. Leader. We are so grateful for all that you have done and putting the American people's voice into this debate. And I've had one question from my Republican House colleagues this week. Where the heck are you? Where the heck are you? You've cut people's health care. You're giving their hard-earned tax dollars to billionaires in the form of tax breaks. And then you don't even show up to defend your own policies, your own bills. Mike Johnson and Steve Scalise are both from Louisiana. Most children in Louisiana are on Medicaid. 64% of all births in Louisiana are paid for by Medicaid. 74% of nursing home residents in Louisiana are on Medicaid. Yet Republicans are willing to shut down government, refusing to even show up for work this week because they want to cut Medicaid by $1 trillion, because they want to defund health care for children and seniors and pregnant women, because they want to pay for billionaire tax cuts. Well, Mike Johnson and Steve Scalise can fight for the billionaires. They can double down, if they so choose, on their lie about who we're fighting for. But we know who we're fighting for, and so do the American people. Democrats are fighting for families, families in Louisiana, families in Massachusetts. We're fighting for American families in every corner of this country. We're fighting for a child's right to go to the doctor, fighting for a new mom's right to have a safe delivery. We're fighting to keep millions of people from losing their insurance and keeping health premiums affordable for everybody. We're here to do our job. It is long past time that Republicans join us and end this Republican shutdown. It's now my great pleasure to yield the microphone to our chairman, Pete Aguilar.
Thank you, Whip Clark. And as we're fighting, Republicans are nowhere to be seen. Our message has been very clear. Cancel your vacation, cancel the cuts, lower the cost, fix health care. That's why we're here. Donald Trump and House Republicans have shown their true colors this week. Instead of protecting health care, they're ripping it away. 15 million people at risk of losing their health care coverage. And while we're here trying to keep the government open, the guidance from our colleagues on the other side, Lisa McClain, my counterpart, the chair of the Republican conference, instructs their members, don't talk about health care. That is their message. So while we're fighting for health care, we're fighting to keep this government open. The guidance from the GOP has been very clear. Don't talk about these issues because they know the American people are with us. Democrats have been at the negotiating table for months, and we want to work in a bipartisan way. We've always wanted to work in a bipartisan way to solve these issues. Republicans control the House, the Senate, and the White House. They own this crisis. They own this shutdown. And instead, they want to use people as political pawns. Russ Vought wants to lay people off. He wants to fire people. He wants to use this shutdown to carry out the agenda that he has wanted all along. It's shameful and it's wrong. Republicans will do everything in our power to fix this Republican mess, to provide health care to people, and to ensure that the American people aren't left out in the cold, because it's the right thing to do. Leader Jeffries.
Thank you, Pete. Questions?
Thank you very much, Mr. Leader. Two quick questions for you. One, I want to get your reaction to Russ Vought announcing this $18 billion hold on infrastructure projects in New York City. Do you think you're personally being targeted?
The Trump administration is targeting the jobs, thousands of jobs of hard-working Americans, working class Americans, and blue collar Americans who are going to lose the ability to work at the 2nd Avenue subway site or at the other project that has been canceled related to the Cross Harbor Tunnel. That's consistent with what the Trump administration has consistently done throughout their time in office. Lose jobs, cause economic pain and hardship for the American people. It's shameful, but it's very consistent with the Trump administration's track record of failing on the economy and targeting working class Americans.
And then just one quick follow-up, just what's happening on the Senate side. It seems there have been some bipartisan discussions on the Senate floor where they may be discussing some type of short-term CR and trying to buy a little bit more time to work through some of these issues like the ACA. Have you been briefed on those discussions? Do you support what's happening in the other chamber?
Haven't had a conversation with Leader Schumer about any developments on the Senate floor, but House Democrats and Senate Democrats remain consistent and in lockstep in defense of the health care of the American people, and that's not going to change.
Leader Jeffries. Good afternoon. Jared Golden, as you know, was the only Democrat on your side of the aisle who voted for the original CR. He just put out a statement, said that the Democratic opposition to that was, quote, driven by the demands of hardball politics, driven by left-wing groups to make a show of opposition to President Trump. That's a pretty harsh statement from one of your own members. Do you refute that?
House Democrats have consistently made clear that we will sit down with anyone at any time and any place to enter into a bipartisan agreement that makes life better for the American people. We will not support a partisan Republican spending bill that continues to gut the health care of everyday Americans. Health care is not a partisan issue. It's not a partisan issue. It's an American issue. And when you strip away health care from everyday Americans, that impacts Democrats, independents, and Republicans alike. When you strip away health care from the American people, as Republicans have done and want to continue to do, you're impacting people in rural America, in urban America, in the heartland of America, from coast to coast, and all points in between. This is not a partisan issue. Defending access to health care that's affordable, standing up for hospitals and nursing homes and community-based health clinics, that's not partisan. That's as American as baseball, motherhood, and apple pie.
But you must disagree with Mr. Golden.
Question?
Mr. Leader, so Russ Vogt just spoke to House Republicans on a call, says that these firings are likely to start within the next 48 hours. Also said that WIC is going to run out of money within the next week, and he just posted that $8 billion of green energy will actually be cut immediately, and it's going to affect 16 states, all of them which have either Democratic leaders or Democratic majorities in their state houses or Senate. What's your response?
These are all things that the Trump administration has been doing since January 20th. The mass firings of federal workers, Trump administration has been engaging in this since January 20th. Targeting the clean energy economy, Republicans have been doing that since January 20th and assaulted the clean energy economy and the creation of good-paying American jobs in their one big, ugly bill. Trump administration has been killing jobs. This is a job-killing administration. Job creation is down, but you know what's up? Costs. They promised to lower costs on day one. Costs aren't going down. Costs are going up. Inflation is going up under the Trump administration. And one of the reasons why Democrats are fighting hard at this moment is because unless we extend the Affordable Care Act tax credits, more than 20 million Americans in a matter of days are about to experience the reality of dramatically increased premiums, copays, and deductibles. Many of them will experience medical bankruptcy as a result. That's why Democrats are fighting hard on behalf of everyday Americans. I'll yield to Katherine to talk about the WIC issue. But in every other shutdown that Republicans have caused, including in the 35-day shutdown that Donald Trump presided over in 2018 and 2019, funding for women, infants, and children, their health, their nutrition, and their well-being was maintained. It was maintained. In every other shutdown, the reason why the Trump administration is threatening now to cut funding for women, infants, and children is because they can't stand that program. They're on the side of their billionaire buddies. They've been running the largest pay-to-play scheme in American history. And Exhibit A of that was their one big ugly bill, which is now law. Largest cut to Medicaid in American history. And they stole food from the mouths of hungry children, women, veterans, and seniors, and all of this was done to provide massive tax breaks to their billionaire donors. We're fighting for the health care of the American people. They're fighting for their billionaire donors, their friends and family plan, which has been all about enriching the lifestyles of the rich and shameless from the very beginning of the Trump administration. So all this talk that we see right now, as if it has anything to do with the shutdown that Republicans have caused, no, it's their ideology. Cruelty is the point when it comes to the Republican Party.
Are they really expecting us to believe that the strategy that they are employing, that they're already making life in this country for working Americans harder and more expensive, that the answer is you shut down government and make life harder and more expensive? That is insane. But that is the argument that they're putting out there. And we just have to base this in reality and facts. They want to talk now about the WIC program. You want to talk now about pregnant women and newborns when 40% of births in this country are covered by Medicaid. They want to say to pregnant women who in a third of the counties, because of their policies, no longer have access to OBGYNs, no longer have access to safe prenatal care and delivery. Now we care about you? Women of America understand exactly how they feel about us and our children. The moms that I've been talking to are so scared they may not be able to get the Medicaid funding they need. We heard from Teresa yesterday, who talked about her 2 autistic sons. She's a single mom. She had to quit her job in order to care for them full time. Without Medicaid, she has no idea what she will do. And these stories are repeated over and over in my own district. A young adult named Sydney, her mom wrote to me and said she has such profound disability